Hi, and welcome back to the Vital Vibes podcast. I'm Dr. Kelley Coble, and I'm here with my husband, Ian.
Hello.
We look forward to talking to you guys today. It's been a busy week. Um, we've been on vacation, technically,
Yeah, for the last, I think this is day 4 now.
day 4 of vacation.
Yeah. So a break from the practice, a break from the normal 9 to 5. Uh, I think that we operate within.
It's been great. We've been rising with the sun, and we've been working outside a lot.
Yeah. Working on, I think we mentioned it in one of the earlier episodes, but building a sauna in the backyard. And I think that was one of the things that we're just like, oh, we'll get a kit. It'll be super easy.
Right.
And then it was like, well, what do we put the kit on top of? And then, well, what about water? And then what about electrical?
Right.
And all of the fun thing. Well, but shouldn't it be bigger so we can hang out
We
outside?
should build a
And we
platform.
should put a deck there. And
Right.
yeah, so all of a sudden, what should have been just a kit that we installed in the woods has now become a very large. Well, I mean, it's going to be like a outdoor grotto
It's
essentially.
gorgeous though. I'm super excited because we've done it all ourselves
Yeah,
and we've done it together. And it's something that neither one of us, ever had any experience
no,
doing, but
zero experience in construction.
but we're figuring it out. I think the
Yeah.
last 3 days we've been outside for like 8 hours a day working
At
on it.
least, yeah.
So it's really gotten us out in our yard,
Yep.
out in nature.
Multiple trips to Lowe's and Dunn Lumber and becoming quite the little like the frequent person there. I got my little parking spot, my coffee mug.
We need a frequent flyer.
I just signed
Uh,
us up for one.
awesome. So the sauna has been a project. It's taking up quite a bit of our vacation. But we also have all the kids home from college and are little. And so we're going
Everyone's on summer
to,
break.
yeah,
Yeah.
we're going to get away, take them to the coast for a few days, go down to Oregon,
Hmm.
see the ocean. I got a new wetsuit so I can go
Yeah.
surfing.
Hmm.
And it's pretty cold water to spend any amount of time in. So,
No, without a wetsuit, you're just gonna jump in and jump out. So
right. And I really want to spend some time in the water,
yeah.
get those photons.
The water photons?
The water
Okay.
photons, sure.
Well, what are we talking about today?
Well, as usual, I did want to mention that although I'm a licensed healthcare provider, I'm a dentist licensed in the state of Washington. Everything we talk about here is just my personal view and should never be construed as medical advice.
Okay.
Well, moving forward, I did want to propose some things today that I've been thinking about a lot.
Okay.
And I want to propose that your mouth is really like a car dashboard.
Okay.
So, you know how when something's wrong with your car, a light goes off and you know something's wrong with a car before it happens?
The electronic instrument cluster.
Yes. So, before the podcast, we were thinking about,
What do you call the dashboard? And I'm like, the dashboard has so many things on it that don't apply to what we're talking about. So what do we call it? And one of the things that Google came up with was the electronic instrument cluster. So
so, like the electronic instrument cluster,
AKA dashboard.
dashboard light on your car, like before notice something's wrong with your engine, the check engine light will come on.
Hmm.
And I was thinking about the mouth, and I'm like, where else in the human body do we have a dashboard to what's really going on inside the human? And I was thinking, like, the mouth is basically a window to the entire body. I don't think that exists anywhere else in medicine.
Hmm.
Like, I can look in the mouth and see things long before they happen.
Yeah.
I can see the warning lights go off in the mouth and have an idea of what is coming for the health of my patients. And I just don't actually see any other. I was like, gosh, is there any other like, branch of medicine that has that? And the only other branch I could think of was like eye doctors,
Okay.
but they're really seeing the input that comes into the body. And I feel like I'm really seeing how the body responds to that input.
Yeah, and you've got, like, general practitioners that are seeing but they're having to pull all sorts of labs and panels in order
Yeah,
to be able to see these things where you're just able to
right.
look, without having really to do anything beyond that.
Right. So if you pull labs or you cut someone open, you can see inside of them.
Mhm.
But I don't have to pull labs
No,
and I don't have to cut.
no.
I can just look right inside and see what I need to see. And then the other thing I think that's really unique is that some of my patients I've had since they were in utero,
Mhm.
and now maybe they're 20 something years old, but I've got to see that dashboard for 20 something years.
Yeah, watch their health evolve.
So I can see changes.
Mhm.
And I just thought that was so unique and it's such a cool window that is really telling for a few different markers.
Okay,
And so I came up with some markers that I thought were really interesting that I can see. So I wanted to talk about those today.
okay. The different things that
Yeah, five
our
things that I
body
can see.
what's that?
Five things that I can see the status on inside of a human body.
Okay,
And so, like, the first one is inflammation.
okay.
And I think the reason I thought of inflammation first is because, certain things like stick with you when you're practicing.
Mhm,
And I had a patient way back in my early years, whose gums were like bleeding all the time.
mhm.
And he would come in, it was always bleeding, no matter what we did, no matter how clean the teeth looked, the gums were bleeding. And literally within like a month of noticing this,
This
the
persistent inflammation.
persistent inflammation, this patient passed away from leukemia.
Okay.
And it was sort of my first signal that I had a window into the human body that I needed to pay
Deeper
a different
attention.
kind of attention
Yeah.
than we were taught in school.
Mhm.
And we were taught in school, like, okay, yes, bleeding gums can be the sign of other diseases, but I want to take it like much deeper than that.
Mhm.
And inflammation is so prevalent in the mouth. Like the signs of inflammation are so prevalent in the mouth that that's one of the first things that I look for when I'm looking at my patients.
Yeah, every new patient that we have come into the practice goes through the same 90-minute new patient
Yeah.
exam, and one of the first things that is on that exam checklist is the current perio status.
Yeah. So our new patient exam is long
Yeah.
and it is detailed because it's a time for data collection
Mhm.
for me. And I need a lot of data so that I can help the patient put together like a comprehensive look at their health.
Yeah, I mean, I'm the one that handles all of the incoming patients that come in. Obviously, you're doing the treatment of it, but I
Right.
have, like, the initial contact with them, and I do get it from a lot of people. They're like, "I've never had, uh, such a long new patient exam. Like, what in the hell are you
Yeah.
doing? What are you looking at that takes an hour and a half?" And it's like, A, we're establishing your baseline
Yeah.
for when we first see you at our practice. We now have that ground zero
Right.
to operate from, and we can see how you track from there, plus or negative. But in addition to that, we're not just a reactionary dental
Right.
practice. We're looking at the holistic system. And that means also looking at deeper things, not just are you free of cavities? Yes, no, okay, off to
Right.
hygiene you go. You're looking for a lot more, and I think that's something that's, you've done for a very long time, and I think it just continues to grow and grow and grow.
It continues to grow. And I mean, at some point, you can drive yourself crazy because you're looking at so much. But at the same time, that's what doctoring is
Mhm,
to me.
yeah,
I didn't go to dental school to just treat cavities.
mhm,
I went to look at the health of my patients and to be a healer.
mhm,
And I think we were trained to do tooth dentistry,
mhm,
but that's not doctoring.
mhm,
And so my new patient exam isn't even enough. It's an hour and a half.
yeah,
And to me, I could even go, I mean, 2.5, 3.5, but I feel like those relationships do develop over time, and I'm able to see
I
more
agree.
on
Yeah.
each subsequent visit.
Mhm.
So that hour and a half, yes, we take that data. I spend at least, an hour looking through all that data. It gives me a really good window to my patient's health, and then that window expands over the years.
Mhm.
And I think that's really special.
Yeah, definitely.
Yeah. So inflammation is like the first thing I notice because it shows up in a lot of different areas.
Okay.
Like, you're right, we do a perio check, which means we check to see if the gums are inflamed.
Mhm.
Healthy gums don't bleed, healthy gums aren't puffy. So, one of the first things we look at is the soft tissue, but I also see inflammation um, in the joint,
Mhm.
like in my TMJ patients.
Mhm.
I see inflammation, um, like if the patients don't heal well
Mhm.
after surgery. And I think decay is a form of inflammation.
Okay.
So, nowhere else in medicine do I think that you can see that just with a quick peek.
No.
And inflammation is, to me, it's a recovery problem. I mean, obviously, it's a response in the body to like damage,
Mhm.
but I also see it as like sometimes we're not getting the energy recovery like on a deep cellular level
Mhm.
that we need. So if there's no injury, there's no obvious like open wound or they haven't had surgery, why is there inflammation in the mouth?
Mhm.
Like there should be
Persistent.
persistent.
Yeah.
So
And
to
especially when you have someone that does have, like, a good diet or good home care, and you continue to have chronic inflammation,
right.
what something's going on. And
Right.
in, like, the case I think that you mentioned at the beginning of this topic, like, the patient that passed away from leukemia, it's not a one-to-one correlation that, "Oh, you have this, it means you have that," but it is something that is you got chronic inflammation, there's something going on within the system that
Yeah.
is causing this because the oral environment isn't the problem here.
I mean, that patient had an electrochemical imbalance. They had cancer.
Mhm.
And so I think when I see inflammation in the mouth and there's no like cause that I can see,
Mhm.
direct cause, then we need to start thinking cellular level
Okay.
because our cells are constantly communicating and the cellular issues will reflect on a bigger arena down the road. And if we can pick that up in the mouth, then we can head it off at the pass and say, okay, there's something cellular going on.
Mhm.
There's no obvious reason for this inflammation. So let's look down to the cellular.
Maybe we need to look at a deeper level that isn't the
Yeah,
mouth that
that
for
isn't the
what's the
mouth.
cause of this.
That's right.
Yeah.
Um, an inflammation with no cause is usually like an electron flow problem,
Okay.
which I know we talked about it earlier.
Yeah.
Um, the cells in the body are not interacting correctly with their environment.
I think the analogy when we were first talking about it this morning was like a hose with a kink in it.
A hose with a kink in it. So this takes me back, way back to like um, Eastern medicine, I guess you want to call it.
Mhm.
So think about meridians.
Okay.
And meridians have been around for longer than we can imagine.
Yeah. And that's where, like, acupuncture is based upon.
Right. So we have always known that there is like a pathway of energy that travels through the body,
Mhm.
like a super highway of energy.
Mhm.
And for now, I want to propose that's light moving through the body.
Mhm. Like the fiber optic cable we were talking about,
Yes.
in I think
Yeah.
episode 3. Yeah.
So we have a fiber optic communication system in our body. It's very sophisticated. And light moves down those fiber optic cables and it communicates along these networks, these highways
Mhm.
inside of our body. And when you have like a kink in the hose, like you said,
I had to dumb it down to
I love it.
we were watching, show Paradise, I think it's on Hulu, where the president, they're in the underground
Oh my god,
bunker, and
yeah.
the president's trying to understand how this city has been constructed, and he's like, "Dumb it down a little," and he just keeps going like, "Dumber,
Dumber,
dumber,
dumber.
dumber." He just sort of keeps lowering it down. He's like, "Caveman talking." So
Mhm.
that's the I went from information superhighway to garden hose with a
Love
kink
it.
in it. Yeah.
Absolutely love it. So, if you have a garden hose with a kink in it, that's our fiber optic cable of information that our body is running through.
Mhm.
That's running all the systems in our body. The kink in the hose likely slows down the water.
Yes.
And sometimes, like you said to me earlier, it actually stops the water altogether.
Mhm. I mean, that
It
was like
stops the
the
flow.
trick as like a kid, like your friend had the hose and you'd pinch it, and then they'd turn it to look at it to see if it was clogged, and you'd unpinch it, and they'd just get sprayed in the
Sprayed
face.
in the
Yeah.
face. I absolutely love
Maybe I'm
it.
the only person that ever did that, but I somehow doubt
Probably you did it more than others.
it.
I'm certain of that. Um, yeah, that
Not surprising.
not if we yeah. Anyhow, yes, you get a kink in your fiber optic highway. That's going to show up down the road
Mhm.
as decreased output of energy.
Okay.
So, I recently took my second level of autonomic response testing. And autonomic response testing is a way of measuring the output of light from the body without doing lab work.
Okay.
And
That's done by, muscle testing essentially,
it's
right?
muscle testing.
Yeah.
So your autonomic response system knows things before you know them.
Mhm.
That it's so smart and it's so fast. And I can measure what your autonomic response system knows by testing your muscles.
Mhm.
So,
I know you just were working with a colleague on it, and
yeah,
you tested for something, and she didn't even tell you
right.
she had this uh, immune deficiency, but you were able to
It was
pinpoint
Lyme.
it down
Mhm.
to the exact strain. Um,
It was Lyme. I went over to her house to practice,
mhm,
and because she's been taking the same
mhm,
she took actually the same set of classes from Dr. Klinghardt years and years and years ago.
mhm,
And so I wanted to practice with her, and there's just not a lot of people around here to practice with. But I
mhm,
got, of course, this incredibly lucky coincidence that she had come into my office and we met and we both discovered that we understood ART or
mhm,
autonomic response testing. And so I went to her house and I'm like, I'm just going to practice on her. And what I came up with was that she had a very specific strain of Lyme.
mhm.
And when we were finished, she said I was absolutely diagnosed
And
with that
this is all done
via
blind
muscle
and
testing
blind to the patient. So it's not like their
completely.
body can be like, "Oh, they're on the thing that I have, so my
No.
muscles tense up." You're doing this all.
Yeah, she had
Yeah.
no idea what I was testing at the
Mhm.
time.
Yeah.
I was just putting different things out in her field, and what popped up was this specific form of Lyme.
Mhm.
So
I think we can get into
it's
that in another.
a completely different
Yes,
episode.
but at least to touch upon, some of A, what it is, and
Mhm.
B, I mean, again, caveman level, please tell Caveman Ian,
Yes.
that's what we're doing here.
So this fiber optic cable, we can tell through a variety of different ways if the light's moving through the fiber optic cable smoothly or if there are kinks in the hose,
It's interrupted. Okay.
if it's interrupted. And I've had some people propose that having necrotic teeth in the mouth, like root canal teeth,
Mhm,
which are not vital, they're
mhm,
dead organs inside the mouth. So your tooth is a living organ.
mhm,
And when we do a root canal, we take out the nerve and the blood supply.
mhm,
So we make it into a non vital organ.
mhm,
So you have a dead organ living in the mouth. And it has been proposed through meridians for many centuries that that puts a kink in the hose,
mhm,
that there's a little blockage in the fiber optic cable that runs along that highway
mhm,
in that tooth. And there's even people who propose that the highways are the same in everybody, so that the highway that goes from the front teeth always goes down towards the bladder
And then
and the reproductive
you know,
organs in humans. And that if there's a kink in some part of the line, like there's a kink in the bladder or there's a kink in that tooth area, that there's effects upstream and downstream.
mhm,
And when you think about light moving through the body on different highways, that makes sense
mhm.
because it's like, okay, we have a roadblock on one of the major, on
And
the
I think
405.
we were gonna talk about that in more detail when we got onto the neurological,
Okay,
side of things.
sure,
Keeping you on track here because that's my
sure.
job.
That's your job. So yeah, we can come back to that. But I think we were talking about
We
inflammation,
were.
and that's one of the markers that I can see, like a dashboard light that comes on when I look in someone's mouth. I'm
Mhm,
like, there's inflammation.
mhm. And it can be caused by the mouth, it can be caused by the diet, it could be caused by something going but it could also be something
Yeah.
deeper within the system.
If I don't see an obvious cause for it in the mouth, they don't have plaque,
Yeah,
or they don't have an open wound, or they don't have a reason to have so much inflammation,
yeah,
then I'm going to naturally assume that that inflammation is whole body
yeah. By process of elimination.
by process of elimination.
Mhm,
So we have a whole body inflammatory issue.
mhm,
And why? I mean, sometimes when I see inflammation, and this can be about the second thing that I see a lot is airway.
mhm.
Because sometimes when we see inflammation, what we're really seeing is someone who's mouth breathing.
Okay, this was your second sort of
Hmm.
dashboard indicator, um,
Airway
the airway, and breathing.
and breathing. So to me, that's been super interesting because one of the places where I see a lot of inflammation is around the front teeth.
Mhm.
And that surprises me because most people brush really well in the front.
Actually, I think that's supposed to be a poll, like, what area do you brush the most? Because I think I am one of the people that just, like, spends all the time on the lower right sorry, my lower right molar. I will just sit
Is your
there
right hand? Your
I'm right-handed, and for some reason, it's more natural for the toothbrush to be in that orientation for me.
okay.
So I'm believed, like, tooth yeah, what would that be? 30 and
30.
31
Mhm.
are impeccably
So
clean.
clean.
However, um, but I know other people that, yes, will just the toothbrush just sits the Sonicare just sits on number 8 and 9,
In
the
the
front
front,
teeth. Yep.
especially kids, right?
Yeah. Mhm.
They just brush their front teeth.
Yep.
Literally, they're like, um,
And they've
but
got broccoli and
stuff in the back.
nuts and gum and everything else stuck in the molars.
Yeah. So why do we see like some patient come in and they're pretty clean, but then their front teeth, like their gums are like puffy, swollen, red?
Mhm.
Um, 99% of the time, I'm seeing someone who is mouth breathing.
Mhm.
And there's a whole cascade of events that happens, but basically, they're not nasal breathing, which is what we would prefer as mammals, and they are just breathing in and out of their mouth, which causes a ton of inflammation.
Mhm.
But why are they, I always look like, why are they mouth breathing? And often I'll find like they have a very super narrow airway. We're starting to develop narrower and narrower airways
Mhm.
um, throughout humanity. And we're no longer like having the same size jaw and structures for the air hole
What
that we
is
used to have.
the reason for that shift?
Multiple reasons, but I will propose that diet is huge.
Okay.
So, carbohydrates, I think we talked about this during the diet
Mhm.
podcast, but we're starting to not have like the big open air holes
Mhm.
that we used to have. Our mouth is shrinking, our jaws are shrinking. We've talked about it in the past, but like we're not nursing our babies.
Okay, so that's another cause then.
Yeah. So our babies are being bottle fed, and you know, anatomy
Mhm.
of the bottle is not the same as the mom.
Okay.
So the suction palatal development is different.
Mhm.
Our babies are drinking, our kids are drinking dairy milk.
Mhm.
A lot of kids are allergic.
Mhm.
So they're developing differently than they would if they were drinking mother's milk.
Is that just more inflammation then?
More
Okay.
inflammation, yes. Um, and then our lifestyle being in front of like blue light all day, we're not developing the way we would develop if we were out in the sun.
So our skeletal anatomy is changing because of these behavioral
That's some of it.
factors. Okay.
Yeah, that's some of it. And we're also heavier, like our bodies are heavier
Hmm.
than they used to be. So the airway that we have developed is inadequate for the size of our body.
Okay.
So if you have, a big beefy man, he's 400 pounds,
Hmm.
but he's got the airway of like a 10-year-old girl,
Hmm.
which we see a lot.
Hmm.
You can't,
How can you have to compare nothing is one size fits all.
right,
So the airway of a 10-year-old female shouldn't be the same size as a 50-year-old 400-pound male.
right.
Yeah.
But his airway was developed, throughout his childhood
Hmm.
and now no longer suits him.
Yeah.
But it's not like you get a new airway,
No.
so the size of the air needed versus the size of the air hole
Yeah.
is quite different. And a lot of patients just aren't getting enough air, but I mean, that's where we're going
Hmm.
kind of with all of this
Yeah.
is um there's so many factors going into why we can't get the oxygen that we need anymore.
Hmm.
And I can see that
Yeah.
right away. I see like a scalloped tongue.
And
Um,
for people that don't know what a scalloped tongue is, that's where the tongue has essentially like indentations, dimples where
mhm,
each tooth is. So it
yeah.
kind of, yeah, I mean,
So the
scalloping
tongue,
is
it's a
what we,
sign.
yes, use to describe it. But for someone that's never heard it before, I
Yeah.
know that's commonly someone will pop up in the chair and be like, what's a scalloped tongue? Uh, so I wanted to pause and make sure we got that there.
So Pete Dawson, my best mentor ever, one of them, taught me that signs always come before symptoms.
Mhm.
And so one of the signs of a breathing disorder can be a scalloped tongue because it's the tongue is trying to fit in the tongue box that you have.
Mhm.
And if the tongue box is too small for the tongue, it presses up against the teeth and it actually leaves indents
Mhm.
in the teeth. So
In the teeth or in the tongue?
in the tongue.
Yeah.
So an indented tongue often means that the tongue box is too small.
Hmm. And that's pushing on the outside
It's
because I know when
pushing.
I had orthodontia as a kid, my teeth were flared because I had a tongue thrust
Yeah.
from the same thing
Hmm.
of trying to find room. And I think remember you also saying with our patients that if that's happening, that's occurring because you're not getting enough air as well. If you're thrusting the tongue
Hmm.
forward, right?
Right. So a tongue thrust, I know a lot of orthodontists who try to close down the bite because the tongue has thrusted the bite open.
Mhm.
But the reason the tongue is thrusting the bite open is to get air.
Yeah,
So when you close that down, it's so no surprise
yeah.
that these patients come back 5 years later
They
and it's
all
open
revert.
again.
Yeah.
And they're like, my bite was closed in the front. I wore my retainer for a while.
Hmm.
I lost my retainer and it's open again.
Oh God, the number of patients we see that have that exact same story. And I think it's like what we've discussed many times is if you don't change the underlying condition, the body's
Right.
just going to go right back to what it knows. You've
Yeah.
got to same with decay. Like if you don't change the the reasons your teeth are rotting, then you're
Right.
just going to get more rot. If you don't change your breathing, that's your breathing pattern is what caused your teeth to flare or become crooked.
Right.
You don't fix it. You don't fix the underlying problem, but you fix the straight teeth, the teeth are going to go right back because they were in that orientation in order to get you air.
Yeah. And I had a great orthodontist. Well, I have a great orthodontist that I
Hmm.
work with. And he's like, I noticed my cases were relapsing and I'm such a diligent
Yeah,
orthodontist.
very.
And he's like, so I did some research of my patients. And what I found is that the airway always wins
Hmm.
because air is more important than straight teeth.
Hmm.
And so going to an orthodontist, to me, going to an orthodontist and getting a straight smile is pointless
Mhm.
unless you're going to an orthodontist who is working with your airway.
Mhm. It has to have that, combination.
It has to.
Unless you just want straight teeth and you don't care if it relapses.
That's crookery.
Yeah.
That's fuckery. You're a crook if you're just straightening teeth.
Mhm.
You need to be looking at what that effect is going to have on the whole system.
Mhm.
And
You wanna
or
be able to stand behind your work. If patients keep relapsing, there's a problem.
yeah, and orthodontists, if you don't know any better, I understand
Oh, of course.
because I wasn't taught to know better either.
Mhm. The
But
system isn't built
no,
around that knowledge currently.
no, and even still, we went out to dinner with a specialist, an orthodontist, and my myofunctional therapist the other day.
Mhm.
And there's a little bit of still being taught that airway is what did they say? It's like what was the word that
Not
the
sure.
kind of like silliness or something in school
No, okay.
that it's not actually applicable is still being taught.
Yeah.
And this was a major university here in Washington. And I just thought to myself, wow, like we we really just don't get it here in the US for medicine.
Mhm.
We just don't get it. Um, if you're looking at like airway therapy and you're saying it's quackery or, I mean, I'm sorry, but things need to change.
Oh, yeah.
And that's a whole nother
Oh,
ball game.
it's an underlying theme that's run through every episode.
I really want to have my myofunctional therapist on the show soon.
Mhm.
Maybe next episode or maybe the one after.
Yeah.
But Chelsea, hi. She probably explained it a lot better than me. But at the same time, like getting people more oxygen is only helpful if their mitochondria is ready for it.
Mhm.
And giving people more oxygen when their mitochondria is not ready for it is not no good.
Okay.
So there's a lot that goes into airway. There's a lot of subtleties, but it definitely needs to be looked at.
Mhm.
And this is why our new patient exam is so long
Yeah.
because I'm measuring the airway on an X-ray, and then I'm taking the head posture
Into account.
compensation into account because when people can't breathe, they move their head forward. That's why a lot of people have a forward head posture.
Mhm.
So there's a measurement that I can convert to see how much compensation the patient is actually doing with their forward head posture to get that airway to look as big as it does on the
So
X-ray.
they're bringing their head forward, so
Hmm.
keeping the shoulders where they are, but bringing
Yeah,
the neck and the chin
yeah,
forward in order to open up what
the
is it,
air
the
hole.
trachea?
The air
Okay.
hole.
Yeah.
Let's just call it that what it is.
The
So
scientific term.
I might see a really big air hole
Uh-huh.
on the X-ray, but then I need to measure the angle of their head posture
Mhm.
so that I can determine if that is a compensation.
Mhm.
And
As you said, the airway's always gonna win.
the airway's always going to win. So if we do our dentistry and we are bringing things backward, which
Mhm.
people still
Do.
do,
Yeah.
we're going to lose. The
Mhm.
dentistry is going to break, the orthodontist is going to fail. It's not real medicine.
Mhm.
It's just what we would hope they would look like.
It's like a cosmetic quick Band-Aid.
It's a band-aid.
Mhm.
And cosmetic dentistry has a very big place in the world,
Mhm.
not just for confidence and looks,
Although that's huge.
but usually form and function go together. So if something doesn't look right, it's probably not functioning right.
Mhm.
Worn, flat, shallow teeth are usually not functioning the way that they were meant to.
No, again, I think it goes back to look at the underlying cause.
Yeah.
If your teeth are worn and you're going to a cosmetic dentist in order to fix the worn teeth, if you don't fix the underlying problem and you just put new veneers over the existing
Right.
ground, the veneers are going to grind
They're going
down
to break.
or they're going to break.
Yeah.
So if you're not looking at the underlying problem to why the cosmetic
Yeah.
results have failed, then it's just going to repeat itself again. I think
Oh,
that's just yeah.
of course it is. And I've turned down patients who wanted veneers because they weren't in a position to get veneers.
Mhm.
Um, so our goal is always to how can we support the position that makes the function work? And when we do that, you get the beauty.
Yeah. And it's
So
lasting then,
it's
rather than yeah,
lasting.
we're not gonna do any work that we don't feel like we can stand behind.
No, and nature has already told us that form and function follow.
Yeah.
So let's get the function back. And as a result, we get the form back, we
Mhm.
get the beauty back. And also meeting with that specialist the other day, he said something like, "Oh, so you are looking at, the underlying function before you do the cosmetic work." And it's like the overlying function is why we do the cosmetic work.
Mhm. That's what
So
got you into it in the first place.
yeah, and even if the patient who's coming in for veneers doesn't understand that I'm doing all that in the background, that doesn't matter.
Yeah.
They're going to get the result they want, and I'm going to get the result that's going to help them
I
in the
th I
future.
think all of the patients that do come to us for cosmetic work understand that because a lot just want the either the 3D printed ones or they just want it their way, and it's like, "Well, I hate to say, we're not going to do it your way because we're not going to do work that we can't stand behind, and if
Right.
we can't make sure that the work fits with your occlusion, with your bite, with your airway,
Yeah.
with your overall health, then we're not going to do it because that could be causing you harm. And having that conversation with patients,
Right.
and I know it does turn some patients off and they're like, well, I'll go
Usually
elsewhere.
not.
Usually not.
Usually
Um,
they're like,
oh wow.
"Oh, wow.
Yeah.
Tell me more.
Uh-huh.
I want to be healthy."
Yes, there's very few people that don't want to be healthy.
Very few.
Yeah.
Yeah. And they all want to be healthy.
Hmm.
There's just, various degrees of like, well, what can I do now and what can I do later?
Hmm.
So, we got a little bit off topic, but
That's what we do.
yay.
Yeah.
But that whole dashboard
Of breathing.
of breathing, I would just love to, get Chelsea on here.
Yeah.
So let's do that in the next 2 episodes or three.
Okay.
But I can see more than that just looking in someone's mouth.
Mm,
I can also see this like the nervous system status.
okay.
And is my patient living in a sympathetic nervous system situation like fight or flight? Are they running from a tiger all the time?
Mhm,
Or are they in a parasympathetic nervous system status where, most of the time they're living relaxed and then they're only using fight or flight when they need to?
mhm,
And I see that when the TMJ patients come in,
okay.
they often are living in a sympathetic nervous system status. And what I find super interesting is a lot of TMJ patients are women.
Mhm. Why
And
is that?
part of it has to do with the jaw having a lot of estrogen receptors on it. So you'll see TMJ patients when estrogen is fluxing, like teenage years, menopausal years,
The frequency
the
increases during those
frequency
periods in
increases.
life. Yeah.
So initially I was like, it's all estrogen.
Mhm.
Um,
Well, you told me, like, when you were in dental school and you were suffering from TMJ, they said it was a woman problem, I believe, or something along those
they said
lines.
it's a mental problem that women have.
Yeah.
And you know how many patients I've had come in who are women who are like, I've been told I'm crazy by 10
Countless.
different
Yeah.
dentists. And I think a lot of these women live in a sympathetic dominant nervous state.
Mhm,
And what I mean by that is they're either the go-goers of the family,
mhm,
they never stop, or they've had a lot of my TMJ patients, I'm not saying all of them by any stretch of the imagination, have suffered from abuse
okay.
of some kind in their childhood. And they live in a sympathetic state
Hmm,
of hypervigilance.
okay.
And there's a lot more reasons for TMJ.
Oh, yeah.
So not every woman who comes in is in, the go-goer of their family or has been abused in their lifetime, but I have noticed a direct correlation between living in a hypervigilant state and having TMJ.
Okay.
The nervous
Whatever the
system,
root cause of that hypervigilant state is.
yeah, it just hasn't settled down.
Hmm.
And you can see it right away because they have overgrown masseter muscles.
Hmm.
So these muscles right here, when you clench and they bulge, those muscles are like huge on patients with TMJ. And um, those muscles can put 300 pounds of pressure on the teeth.
Hmm.
So when I first started doing TMJ, I'm like, how do we spread the load of 300 pounds of pressure? How do we get it distributed across all of the teeth equally? Like we're building the sauna,
Hmm.
and we had to put those like joists and what are the little boards to
Your
push?
terminology of construction is wonderful.
I just To me, it's like, why don't you just call things what they are? So it just pisses me off that you've got like
Are
all
you
these.
talking about beams, joists, or blocking?
Yeah, just call it what it is. You've got your support beam. I get that.
Okay.
What's the joist? Like
Joist
the
is the one that
Yes,
runs
I know. I
perpendicular to
just
the
built
beam.
it, so I know
Yep.
what it is, but then it's like, can we just call it what it is? And then there's those little blocks that go in between to help with
I
the
mean, they couldn't have
torsion.
named that better. It was blocking.
Okay.
Little blocks, blocking.
Little
Yeah.
blocks. Okay, whatever. But we know that you have to spread the load evenly across the sauna platform
Hmm.
or it will collapse.
Yeah.
And with TMJ patients, the load is usually not even, almost always.
Hmm.
Um, there's a perfect balancing point between the jaw joint, the bite, and the way the teeth fit together. And if it doesn't all like gel together and match, then things get destroyed.
Hmm.
And it's either going to be the teeth or it's going to be the joint.
Hmm.
Depends what's weaker,
Or both.
or both. So people with really strong teeth, it usually goes straight to the, jaw joint.
Hmm.
And people with really weak teeth, the teeth wear down.
Hmm.
So these sympathetic dominant patients will quickly wear out their teeth or their jaw joint. Not to mention, a lot of these sympathetic dominant patients don't sleep at night.
Okay.
Their circadian rhythm is off and their sleep patterns are poor. And then that, goes down to a cellular level.
Okay.
So I can see that. That's a dashboard light, TMJ.
Hmm. And nervous system on
And
a
the
deeper
nervous
level.
system on
Yeah.
a deeper level. And what else happens when you live in a really highly energetic nervous system? You get a lot of cortisol. So cortisol tells you to build fat around the middle. Building fat around the middle of your body um, disrupts the way that you breathe at night, puts a lot more pressure on the breathing apparatus, which then tells your body to hold on to more fat around the middle. We need more cortisol.
And cortisol is also released every time you have sleep disturbed breathing, right?
Every time you stop breathing, when you have apnea, the cortisol raises. It tells your body, I need more fat around the middle.
So you can have patients that are like, I keep trying to lose weight.
Yeah.
I'm eating healthy. I'm working out and I'm still packing pounds on.
Yeah. It happens all the time.
Yeah.
And the truth is, a lot of people in the US are packing on pounds and they're not eating that much.
Hmm.
And it's not it's not directly their fault.
It's just not diet specific.
It's not just diet, it's your environment.
Hmm.
And the environment that we are, living in promotes the body to make changes to hold on to fat and then introduce GLP-1s to get rid of that fat, and you introduce just a trainload of problems to that patient. So I'm not sure that we're headed in the right direction.
Well, you said a trainload of problems. And I realize that this could be a larger conversation,
Yeah, I
but
think it should be.
no, but, like, let's what are some of the quick ones, the quick takeaways of, like, what is a GLP-1 for those that don't know what a GLP-1, we're looking at something like Ozempic,
Right.
rapid weight loss. We've been watching, a program, unfortunately, it does not have the no commercial features that we do on Netflix, so we're stuck watching the commercials. I swear every 3rd commercial is for a GLP-1 weight loss drug.
It is. We've been watching Paramount.
No,
Um,
Peacock.
Peacock. Okay, we've been watching Peacock.
Peacock.
And thank you for the
Yeah. You like my peacock
I
impersonation?
won't forget it now.
Yeah.
I
It's
won't think
stuck
we're
in your
watching Paramount
mind.
anymore.
Yeah, there you go.
Um, we finally decided to watch Yellowstone
Mhm.
because every now and then we just need some good old brainless
Yeah,
dopamine, whatever
at
you
the
want to
end of the
call it.
day.
So our show of choice has been Yellowstone lately, and literally every 5 minutes is a GLP-1 commercial.
And I'm not sure if it's because the people that watch Yellowstone are all
I'm
in
wondering.
need of a GLP-1, or if it's just the entire world and that's all that is.
It's the entire world.
Yeah.
It's a peptide. And I think what's interesting is that I never saw a commercial for drugs until I remember my kids were probably like 5 or 6, like 15 years ago.
Mhm,
There was never a single solitary drug commercial on television
mhm.
when I was growing up. It did not
No, I don't
exist.
remember 'em.
And now that's all I see.
Mm.
And it's like side effects include death. Um,
Depression, you
blindness.
blindness,
I
yes.
mean,
I mean, it's a literal like, these are symptoms that are being included in the advertisement, yeah.
but like the biggest thing I see with drugs in my practice is that every single solitary drug causes a dry mouth on some level, just about every single one of them.
Mhm,
And so when we're talking about dashboard lights, saliva is one of my top five,
yeah.
and hydration.
Can you go back to the GLP-1 before we continue down that road? Either you're fighting me on this one or,
It's not
um
that I'm fighting you. It's just GLP-1 is like such a can of worms, and it's something I really do want to spend a whole podcast on because everyone I care about, like I would say 80%, well, I don't know if it's 80%, but a a lot of my patients are on GLP-1s, and I am very happy that they're losing weight
mhm,
on that level because I'm seeing the typical issues that come along with weight gain go away.
mhm.
But the can of
It's
worm,
doing the job of losing weight, but there are other things that are happening that I don't think the side effects have really been studied well enough yet.
there's no good data,
Yeah,
long-term data for humans, and that's scary as hell.
mhm,
And I don't just rely on like data. Like that's not my I know that Western data can be very misleading.
sure.
So that's not my MO. But the biggest issue that I personally have with GLP-1s is that I can't sedate a patient who's had GLP-1s because they still have food in their stomach, so they have to take a break from the GLP-1s for like a week. I don't care about that. Like I'm willing to wait a week to sedate a patient. That's no issue at all. But that there is food rotting in their intestine and their gut for over a week scares the shit out of me.
Mhm,
And what I know from cleansing and juicing and um, life in general is that you want food to move through your body fast.
yes.
The faster, the better.
Yeah,
And if there's something that patients are taking that slows down the release of food from their intestine, I'm scared to death.
mhm,
I am scared that the rate of cancer and colon cancer is about to skyrocket.
mhm,
And that's not what I want for my patients.
yeah,
It's not worth it.
yeah.
And if you think about what you eat, you're putting it into a 98-degree
Oven,
oven and you're letting it sit for now. I mean, 1 day, 2 days. Now
a week.
we think a week, but could be. Some of the anesthesiologists are saying
Three,
like 3
3
weeks
weeks, I think.
before they'll operate on someone on a GLP-1 because they don't want anything in the intestine.
You know,
And to have something fermenting in your intestine at 98 degrees for 3 weeks,
mm,
it's terrifying to me,
mm,
especially meat.
yeah,
Like, I'm not vegetarian for a variety of reasons. But, I do know that rotting meat in your intestine is not a good thing.
yeah.
And that's all I wanna say about the GLP-1s right
No,
now.
thank you, but I just appreciate rather than just saying touching on it and then moving past, like, let's at
Well,
least explain a little, so thank you.
and I don't wanna alienate people who are trying this and having, like, what they see as success.
Mhm,
I don't wanna poo-poo on the success, but I do wanna let people know that they might be doing a lot more harm than good.
mhm,
And I think that it's just being done out of sheer desperation because these are the same people who aren't eating that much who are gaining weight.
mhm,
And I know why, and I want to go into that, but GLP-1 is not a long term solution.
deal with the devil.
It's a deal with the devil.
Yeah.
That's all I want to say about that.
Thanks, Forrest Gump.
Forrest Gump's come up a lot this
It
week.
has.
Mm. So for dashboard, I mean, we were just getting into saliva and we started talking about GLP-1s, but
Mhm.
I'm like, I'm
Dry
gonna look at
mouth.
someone's saliva. Is it thick?
Yeah,
Is it sticky? Is the tissue dry?
yeah,
And saliva is one of the most protective substances in the body.
yeah.
It supports healing, it delivers minerals. We talked earlier about how it might provide like a special coating on the outside of the teeth
Mhm,
that protects the tooth from tooth decay. And the one thing I do know is when I see a dry mouth, I always see cavities.
mhm, yeah,
So if my patients have a dry mouth, 100% they have cavities.
mhm,
100% of the time. And it's a warning light. It's telling me that something's going on the mitochondrial level. If we don't have the water balance that we need, like we talked about Dr. Pollock's structured water, remember easy water?
mhm,
Then the battery is missing in the body.
mhm,
So a lack of saliva tells me a lack of battery.
mhm.
And that's a huge like dashboard light for me.
Yeah. I know with our new patients, one of the first questions that you'll ask them is what medications they're on.
Yeah,
A, because it's shedding light on what other issues do they have going on in their life, whether it's high cholesterol or
right.
hyperthyroidism, um, blood pressure, whatever it be. But then if we start seeing multiple medications, the
Yeah,
first follow-up question is, do you have a dry mouth?
right. That's one of the first questions I ask. And if you have a dry mouth, we are on a road to cavities.
Hmm.
We're on a road to possibly not sleeping right.
Hmm.
And we're on a mitochondrial health road that we need to go down real quick.
Hmm.
So our energy production is probably compromised. Our ability to make easy water is likely compromised. And like the whole battery of the body could be acting poorly.
Hmm.
And there are some medications that patients can change. Like I never tell patients to go off their meds.
Hmm.
But there are medications that can be changed, but the eventual goal is to get off your meds.
Hmm.
And that doesn't mean quit your meds. That means our eventual goal is to get your body functioning so primely, supremely as it was meant to,
Yeah.
that you no longer require a single solitary medication.
Work with your providers to get off of the drugs. The drugs are a crutch to get you better, but not
Yeah.
the long-term goal that you're supposed to live on them forever.
We should not be living on medication.
No.
We weren't designed that way. We were designed perfectly. We were designed as perfectly functional, beautiful beings. And it's already been worked out, structured. We just need to get in the right environment to let our body do what it knows how to do.
Hmm.
Because there is nothing that I'm ever going to do that is going to be as good as what was already made.
Yeah.
So, um, we just need to get all the other stuff out of the way.
Yeah. Not one drug for this and then another drug to suppress this
Well,
the
that was
side
what
effects
was
of
funny is we were watching Peacock and they were like, okay, this drug is for this. And now, was it dyskinesia when they were twitching?
I don't remember,
It was
but I
it
do
was
remember the
dyskinesia.
poorly acted commercial that
And
yeah,
the man was twitching because of a drug that he was taking. And so they were recommending that he take
another drug.
a second drug to stop the twitching.
Hmm.
And I'm like, this is so much fuckery.
Yeah.
Like, where does it stop?
Yeah.
Like, where do we stop this from, being the way that we treat our bodies? And I don't actually blame Big Pharma. This is a lot deeper than Big Pharma.
Hmm.
Big Pharma is just like, okay,
It's just a business.
I can make some
Yeah.
real good money here.
People don't want to twitch. We'll come up with a drug that stops that. And then if there's a side effect that the twitching drug that the side effect from the twitching drug creates something new, then they'll make a drug that stops that side effect. And
That's right.
yeah.
And so on and so on. And every drug has a side effect.
Hmm.
And so you'll never be free.
No.
You'll just keep taking a medication to stop the side effect of the other medication,
Yeah. And then all of a sudden you're on 18 medications.
which most of my patients, like, I will not lie, are on so many medications,
Mhm.
at least 5.
I'd say the average. Yeah.
A fair number need to bring in a separate list.
Yeah. It's not a question that they can answer. They have to,
They have to
they
have a
have to,
list,
consult their my chart.
and I understand, like, that is what has been given to them to try to help them, and they're doing their damnedest to follow the instructions of their doctor.
Hmm.
But at the end of the day, I don't think that we're necessarily heading down the path of healing.
No.
And it makes me think of vitamin D, which actually was one of our dashboard like markers was vitamin status.
Okay.
I can see the vitamin status of my patient when I look at, like, for cavities. And it makes me think of vitamin D because vitamin D, I understand in Washington everyone's deficient
Hmm.
because no one goes outside because it's always raining. But everyone in Los Angeles is vitamin D deficient now.
Okay. Why is that?
Good question. um, because their bodies aren't able to process the vitamin D that they're getting from the sun. Either A, they're wearing sunblock, so they're not getting it,
Hmm.
or B, they're not processing it the way that it was meant to be processed. And I think that's more likely. I think it's both, but
Okay.
I think that vitamin D and vitamin K2, they affect metabolism, the immune system, like everything in our body is somehow helped through vitamin D and K2. But if you can't process it because you have underlying mitochondrial issues, you don't have the energy to process it, or because you're wearing too much sunblock, it's going to show up in the mouth. And I see it all the time. And that's where you see cavities.
Okay.
Like, I have a patient who came in a couple years ago and she had cavities on every surface of every tooth.
I remember this.
And I asked her what she ate, and she said pizza. So she ate carbs only. And by the way, there is no like minimum requirement for carbohydrates in the human diet.
No. The food pyramid is upside down.
And it's funny because people are like, well, I need to get 30% protein and 30% carbohydrates. And it's like, there is no percentage of carbohydrates that people need to.
Minimum.
There's no minimum daily allowance for carbohydrates. You don't need to get any carbohydrates to live.
No.
And yet this patient was, we already
That
talked
was their
about
diet.
and cavities coming from carbs, and they were eating pizza and carbs, chicken nuggets, I
That
think.
was the other big one. Yeah.
Which, if you think about what a lot of children want now, what parents are feeding their children, they want pizza and chicken nuggets. It's funny.
It is just because I think it's like the joke of like chicken nuggies.
Chicken, chicken nuggets,
Yeah.
nachos.
Nachos.
But the mom, so this patient had a mom with them, and the mom wanted me to treat all the cavities, and they were going to spend upwards of $20,000
Hmm.
to treat all these cavities. And I said, "What kind of sleep, do they get?" And the mom was like, "They sleep all day
Hmm.
and stay up all night. So they get no sun,
Yeah.
zero outside time, zero photons."
Hmm.
And then the mom was like, "They're on their phone all day. When they're not sleeping, they're on their phone.
Hmm.
I'm sorry, all night. So when they're awake all night, they're at blue light."
Hmm.
And I just thought to myself, I'm screwed.
Yeah.
Everything I fix here is going to fail.
Hmm.
And every single cavity that I fill,
Even with proper hygiene, you haven't fixed the underlying problem.
and hygiene wasn't good too.
Yeah.
But I'm just thinking to myself, there's no winning here. And there's no winning for the health of this person. Because if this is what the mitochondria have to work with, the spinning of the mitochondria is going to be so slow that um, there's no winning for this patient.
Hmm.
So things have to change within the environment of the patient to get rid of the cavities. And it doesn't matter how good I am at fixing the holes in the teeth. I'm pretty good. Great, by the way. but
Agreed.
but there is no magic wand that I have that will overcome the issues that will happen with that patient. So the dashboard on that patient, every light was on.
Hmm.
The nutrient and mineral status, that was flashing.
Hmm.
The airway was flashing. The nervous system was flashing. Um, and I think, if you have a car and every single warning light is on, like, you can't just sell the car in this case.
Yeah.
This is a human.
No, that's where the analogy of the dashboard goes away. We don't have the ability to trade in the car for a new one.
No.
We have the car, our body for
Yeah,
life.
this
So
is it.
if all the warning lights start going off, we really need to start paying attention to them. It's not when one of them goes off, we should pay attention.
Right.
If all of them are going off, it's really time to start paying attention.
That's right. And so I look at the dashboard on every single new patient, every single existing patient, to see how many lights are on and how many lights were on 5 years ago and where are we heading. And then I sit down with those patients and we have a long consultation about what I can do and what they need to think about doing as well.
Hmm.
Because if all they want is for me to fix the cavity, I can do it.
Yes.
I'll do it great.
Mm,
And I'll keep doing it.
yeah.
I'll do it every single year if they want me
But they'll
to.
keep coming back.
But they'll keep coming back, and the more warning lights are going to start going off.
And the problems will start getting deeper.
And the problems will start getting deeper because we've never solved the problem in the first place.
Yeah.
So, my goal isn't just to do the dentistry, to patch to get the light to turn off for a hot second. I want it to stay off, and it can stay off. And so, my goal in the practice is to help people learn how to keep those warning lights off, and know how to see them, and then how to make sure that that car stays around forever.
Hmm.
And we have the advantage of having a, I mean, our body is so evolved compared to a car. We have the advantage of perfect, perfect knowledge in our system.
Hmm.
Our body is a perfect running machine. Like, it's beyond anything that we could ever imagine or will ever build. It's so intricate and so The knowledge in our body is so advanced that all we have to do is get out the way and let it do its thing. We are perfect beings and we have the capacity to heal like no other. So put yourself in the right environment and all this other stuff can just
Mhm.
go away. So, yeah.
Were there any other dashboard lights that you
No,
wanted
I
to
mean,
touch
I think
upon?
we covered them all.
I think we did, and maybe I preemptively cut you off then earlier, and if I did, I apologize that I did wanna circle back. We were talking about meridian lines, and,
Yeah.
I did wanna go back to that, though,
Let's go
because I
back to
did
that.
think that was important.
So cool.
I think it's maybe one of the cooler things that I've seen in the practice, that just and even when I talk to patients about it, it kind of I think it's in a dashboard. I don't know if we have, like, a label for it, but at the same time, it it's so far beyond coincidence
Yeah.
that it's, um, it's staggering.
Yeah.
And so, yeah, I just sort of wanted to circle back because I know I stopped us short on that one.
That's okay. Let's touch on that and then let's make it a whole podcast.
Sure.
But so we have our fiber optic cables running through our system. I think they're running through the fascia, but nobody knows
Mhm.
exactly um,
The connection still being determined.
determined. Even the light is in debate if
Mhm.
you look at traditional Western medicine, but I think in my mind, there's no more debate. Like we're electrical beings.
Mhm.
Um, so if you look at these electrical lines that have already been laid out in the past generations of medicine, it's really interesting because we'll see a blockage, like we'll see a fractured like front tooth.
Mhm.
And maybe it's a front tooth that's had a root canal, maybe it's a front tooth that's highly twisted. And I'll tell you, 8 times out of 10, I'll look at their medical history. There'll be something going on with their bladder or their reproduction
Mhm.
or their prostate.
Mhm.
And it's so interesting to me. I'm like, Ian, look at this. Like, and I won't even tell you. I'll be like, this patient has a prostate problem. What tooth do you think had a root
What
canal?
what what is the tooth that brought them in today?
And you'll be like, tooth number 8. And I'm like,
Yeah.
yes. So
Or close 9.
or
Yeah.
night. So ignoring these energetic pathways that have already been worked out through history, I think is foolish.
Yeah.
They need to be at least thought about.
What's the other big one? I think it's tooth
Lately,
14.
we've seen 14 in breast cancer,
Yeah.
and the patients are in for recurrent breast cancer. They have breast cancer,
So for
and
tooth 14 is the first molar on
first
the
molar on
left,
the
upper
left,
left
like
side.
13, 14, and we just see a lot of root canals there.
Yeah.
And I'm not saying all root canals cause disease. Absolutely not. But we're looking at those like energetic lines, those fiber optic cables,
Garden
those
hose.
garden hoses.
Yeah.
And there's a kink in the garden hose at that level. And sometimes that just slows the water down.
Mhm.
And in a healthy person, maybe it doesn't matter.
Yeah.
But maybe it matters in a patient who has a lot of other kinks in the garden hose. And so I think it's more fascinating than anything else that we've looked at lately. I really want to get more involved in, like, I even told you I want to make a database in our office where it's like, okay, here's the diseases that the patient has. Here's the
Extracted root canal
extracted root
um,
canal, twisted,
teeth,
injured tooth.
and what is the medical history that corresponds to
hmm
that patient.
And I don't know that that's 100% been done, but I think it should be.
Yeah.
And I think it's worth thinking about if you're a patient.
Yeah. If
Like you don't put all your stock in one idea ever.
Mhm.
Do your diligence again, be curious about your own health and be like, okay, where do I have dead organs in my body? Let me get a dentist to 3D x-ray those areas to see if there's signs of bone loss around those teeth.
Mhm.
Is the bone being eaten up by infection? If it is, I have an underlying low grade infection in my mouth that I can't handle.
Mhm.
If it looks healthy, I'm handling it. This is the way I see it.
Mm.
Um, the kink in the hose is small, but there nevertheless is a
There's
kink in
still
the
a kink.
hose.
Yeah.
There's a dead organ in my mouth
Mhm.
that is a kink in the hose. And if the dead organ is infected, which I just took a tooth out last week that was highly infected, um, is that causing a problem for me as a patient? Like, let me get curious
Yeah.
and
Where
think
else
about
in the
it.
system could this have a trickle down effect?
Yeah, and where are there kinks in the hose? And our and that's what's so cool about ART. I know I keep coming back to that, but it measures the coherence of light coming out of the body.
Mhm.
Where is there not coherence?
Yeah.
So, as a practitioner, I don't use ART to diagnose. It's just another tool in my toolbox, like
To verify.
to verify.
Yeah.
If this tooth looks like it has an infection, the patient has breast cancer in the same meridian, the ART is telling me there's incoherent light coming out of the tooth, the x ray is telling me there's an infection around that tooth. I mean, that's a lot of data
Mm.
that I want to give my patient so they can choose what to do with it.
Mhm.
Um, and I don't think that we should ignore what's been done already. There's thousands and thousands of years of medicine behind us
Mhm.
that just because we now have molecular medicine and we saw all that other stuff as like woo-woo medicine, that's that's real stuff
Yeah.
that's already been worked out. Like, why would we not take that and like try to figure out
And continue to build off of it.
what is it about that that's true?
Yeah.
Because it's been true. It's been working for thousands of years.
I don't think anyone's going to argue with acupuncture. I think
Yeah.
almost
Some
every
people will.
you'll always find someone that will
Yeah.
give a one-star review to the most
Remember,
beautiful.
so we love to stay at the beach when we travel and we always look at reviews.
Yeah.
Then we're also Airbnb owners, so we understand like
Mhm.
how reviews work and what you can gain and not gain from reviews. And so we always go to the one stars because we're like, okay, let's see
What
if they're
did someone have
legitimate.
to bitch about? Yeah.
And
I think it's
we
our one of our
it's
favorite
one of our
ones
favorite
was the
ones.
ocean was too loud.
The ocean was too loud. So
And it
they
was just like you can't there are some people you just can't make happy. It does not matter.
so you picked an oceanfront room
Yeah.
on a busy ocean, like big bustling waves, and your chief complaint, you gave it one star because the ocean was too loud.
Yeah.
It's just
No other feedback. Ocean too loud.
ocean too loud.
Yeah.
Yeah. So
Can't make everyone
you
happy.
can't make everyone happy. So there's someone who will argue with everything,
Yes.
but I believe there's nothing new under the sun.
Yeah.
And so finding those bits of information that have already been worked out by the geniuses before us
Mhm.
and finding out why they are true.
Why do these links exist?
Yeah,
And let's pay attention to them. And it's hard to say because it's a sort of a chicken or the egg
it is.
scenario. We can't say does a dead or infected tooth here affect something downstream, or does the something downstream affect the tooth? Um, we don't know that yet,
Nobody
but
knows.
we do know there is a tie, and the number of instances that keep being reinforced by
Right.
the case studies we see every day, it's not something that can be denied.
I won't deny it.
Yeah,
In fact, I'm looking at it
yeah,
because I'm looking at everything for my patients because that's my job.
mhm,
That's what doctors do.
yeah,
That's what doctors should do. And someone said on the other day, and I cannot remember who it is, they said, choose who packs your parachute.
mhm,
So when you're choosing your doctor or your dentist, they're packing your parachute for you.
mhm,
And why wouldn't you be excruciatingly selective about the person that does that for you? If
don't
you're not going to pack your own,
yeah,
which I think actually you should.
Yeah.
But sometimes you need help. I understand that. Pick someone who is so detailed and so
Methodical.
caring and methodical and who's packing that parachute to make sure that you survive that jump.
Do not search for discount parachute packing. Similarly, don't search discount dental or discount medical work. These are things you don't want discount or cheap. It's like sushi. You don't want
Gas station.
cheap gas station
Oh,
sushi. This
yes, I
is
do.
not something that you want. So I understand that we are not made of money and we do have to be
Me too.
frugal, but there are certain things where the cheapest is not the right answer.
Right.
And if this is the parachute that you are packing, don't settle for cheap.
And don't let the insurance company pack your parachute.
No,
They don't care if you live or
no.
die. They just want money for packing the parachute. And Ian's right. Like, not, um, some medicine can be quite expensive, especially if you're paying for it out of pocket. But I want to get you to a place where you don't need to pay me.
Mhm,
Like, that's my whole goal. If all of my patients walked in tomorrow and their mitochondrial health was great and they didn't have inflammation and the dashboard lights were off, I'd be thrilled.
mhm.
I would be thrilled. And I know that's not going to happen.
No.
My job is really to get you to the point where you don't need to pay for medicine.
Mhm. I mean, I think that's a little bit of the purpose of the podcast is education
Yeah.
of, let's introduce some things that we traditionally aren't taught in school
Yeah.
or that Western medicine isn't traditionally teaching us to be on the lookout for or to pay attention to, and present ideas of like, hey, look deeper,
Yeah.
look a little bit deeper at what's going on in yourself
Mhm.
and figure some things out and do some research and ask some important questions because this is your life and you have one of them.
And I think it's hard because as we get dumbed down by blue light and we get dumbed down by short form video and we get dumbed down by not seeing the sun and the
And
food that we're eating
AI
and
and
AI,
yeah.
it makes it harder for us to like actually have the cognitive ability to think for ourselves and to do the right things for ourselves. And it's a vicious cycle.
Mhm,
But that's why I'm making this podcast. That's what Vital Vibes is. It's to help us break the cycle and to be cognitive and stay cognitive and make the decisions that we need to make for ourselves to stay healthy and avoid the traps that are set by people who are just looking out for their bottom line
mhm.
and not your health. So that's why we're here.
Yeah. Um,
I think it's a good stopping point.
yeah, I guess so. Anything else that you would like to touch upon?
No, as always, like I'm happy to answer questions that people have. We are in the process right now of redoing the lighting in our home.
Mhm.
Um, Obviously, nothing replaces the sun. Nothing
No, but
comes
we
close to
we live in
replacing
the
the sun
Pacific Northwest,
for now.
and yes, that's true as well. However, I'm looking outside right now. Our days are incredibly long, but in about 6 months they will not be.
Right,
And when it gets dark at 4 o'clock, it's
right,
hard to go to bed at 4 o'clock. So
right.
we have to light for those
We're thinking
periods.
ahead. So currently, we turn the lights off pretty much all day, all night, and we go to bed with the sunset at 9 or
9:30, yeah.
9:30. And I know the dark days are coming. In
So I sound like Game of Thrones.
I feel like the Game of Thrones,
Winter is coming.
but it's true. When winter comes, our bodies don't operate the same. So we're in the process of redoing our lights. We'll let you know how that goes.
Mhm.
Redoing our light bulbs. I know a lot of people have been asking me for practical, things that they can
Takeaways.
takeaways
Mhm.
that they can do to, deal with
Integrate this.
integrate all of this. We've given you quite a quite a few. like the way to brush your teeth, the way to eat, to go outside, to make sure you see the sunset and the sunrise. As I'm speaking, the sun is coming out for the first time, and there's a baby deer in my yard right there. There's the mom and
Oh,
two
yeah.
fawns.
They're back.
They're back.
There
There's
they
a
go. There's one that's like
one is a
practically white.
very pale
Yeah.
fawn. Oh, they're super cute. Thank you for bringing the sun out and the fawns.
Our youngest is gonna be so stoked. She likes to name
Oh,
all the
she names
wildlife.
we had some bears in our yard the other day. They are now
Maple and Fern
Maple and Fern. We have Barry the deer,
and Daisy the deer.
Daisy the
But now we're gonna
deer.
have
Now we
2
have two new
others. Yeah.
fawns. So she's coming today, and
And a
we'll
possum.
Harold and Gerald. There's two
Mhm.
possums.
And hummingbirds.
That's Heidi and Klaus.
Yep.
Oh, Lord. We're losing our credibility.
Uh,
But yeah, we'll keep you posted on the lighting, the light bulbs,
the naming of the deers.
the naming of the deers. I've been trying out a lot of different juice companies. It's really hard to find people who produce, it's impossible to find people who produce fresh green juice in glass bottles.
Mhm. You're trying to avoid plastics.
I am, and I'm juicing, 64 ounces of green juice a day. And it's hard for me to keep up with that with my schedule.
Mhm.
Like I do it, but
That's a lot.
it's a lot of work. And so I've been trying to find places to deliver, the fresh pressed green juice in glass bottles. And it's just been almost impossible.
Yeah. So if you happen to have said business
Yes,
and are listening to this, or you know someone that does, leave us a comment, please, and
please
let us know
do.
because we were happy to A, give that a try, and also B, spread that to the listeners that we have.
Absolutely. And
So,
we've talked about getting your water from the spring source. My sister and her partner were just sending me videos about going up north and getting their spring water.
mhm,
You can also buy deuterium depleted water online, which I've been doing, and that's a pretty easy yet expensive
proposition.
proposition. I'm just doing an experiment right now, so that's why I've been ordering it.
Hmm.
Um, but green juice is naturally deuterium depleted, so finding that source would be super helpful. So yeah, we'll let you know about the light bulbs. But for now, we're just telling you to get outside,
Yeah.
go barefoot, pick up some photons.
And just pay attention. Pay attention to what your body's telling you.
Yeah,
It's telling you for a reason. Symptoms aren't meant to be ignored. They're not meant to be suppressed with a medication. If there is a problem in your body, it's going to present itself. And I think that's what the key takeaway from this
yeah.
episode was your mouth is that dashboard light. It is that electronic instrument cluster. And you don't drive with the check engine light on
No,
for 10,000 miles and
please
just
don't.
hope it goes off.
Please
So
come see me before then.
exactly. If there's
I'll help you
something
work it out.
going on in your mouth, it's giving
Hmm.
signs, uh, pay attention to them.
Let's work it
Study,
out. Hmm.
do a little digging. And I'm not saying go on WebMD because I think that's probably just one
That's
of the
the worst.
no, it's the worst, but at least
Find someone to pack your parachute.
there you go.
Yeah.
So
Thanks.
yeah,
Thanks for joining us.
yeah,
And
I will link information in the description below if you want to email us any questions, vitalvibespodcast@gmail.com. If you're looking for Dr. Kelley here, practice website will be linked below, but that's drkfisher.com
spell
as
my maiden name.
maiden name is what
Hmm.
the practice is under. But if you're Googling Dr. Kelley Coble, Dr. Kelley Fisher, they're one and the same.
One and
So
the same.
but otherwise, yeah, thank you so much for joining us.
Thank you. We'll see you at the next episode.
Have a great week, everyone.
Have a great week. Happy 4th.